Dear viewers, welcome you all to our show, Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today is a great day for Orthopedic Solution Academy, as because of we are going to celebrate the 100 years of Ilizarov around the world. We all know that the magic of Ilizarov. We have already discussed the magic of Ilizarov in the last 17 episode of our program, the Orthopedic Solution Academy. But who is behind this Ilizarov? Who is the real magician of Kurgan? The man is the Gabriel Abramovich Ilizarov. I would like to show my deep respect and gratitude and salute to that magician who invented this Ilizarov and who is the man behind the millions of smiles, behind the millions of recovery, and behind the history, and behind the starting of new arena of orthopedics, that is the Ilizarov. So first, I want to give my salute to Gabriel Abramovich Ilizarov, the legendary orthopedic surgeon and the inventor of Ilizarov. Dear viewers, today we have some foreign faculties as well as the Ilizarov lovers with us. I want to say them Ilizarov lovers as because of they are not only the Ilizarov surgeon, but they are the real Ilizarov lovers. They love the Ilizarov, they implement the Ilizarov, they improvise the Ilizarov, and they make the advancement of the Ilizarov all around the world. And today we have two participants from Bangladesh. One of them is Professor Mofakhkharul Bari sir, the pioneer Ilizarov surgeon in Bangladesh and the president of Asami, Bangladesh. Professor Mofakhkharul Bari sir.
Thank you so much for introduction.
Thank you, sir. And the second one is Professor Abdul Mollah sir, the president of Bangladesh Orthopedic Society and the secretary of Asami, as well as the director of Nitor. Welcome, sir. From Russia, we have two learned academic panel. One of them is Professor Shevtsov, sir. He spent 18 years of his golden moments for Ilizarov, and he has more than 350 publications and has written many books. And he came to Dhaka more than 8 times. The legendary professor, Professor Shevtsov, sir. So welcome to our show. And another one is Dr. Novikov, sir, from Russian Ilizarov Center. And I would like to request Professor Novikov, sir, to join with us. And I think he will join with us within a short period of time. And from China, we have Dr. Jiancheng ZANG from Qinsibe Orthopedic Institute, Beijing, and the secretary of Asami, China. So welcome to our show.
Good afternoon, everybody.
Good afternoon. And from India, we have two participants, as well as before, Professor Dr. Harshad M. Shah, the Ramaliah Medical College, Bengaluru, and the past president of Asami, India. So welcome. And another one is very enthusiastic, Dr. Shamsul Huda, consultant orthopedics, Ilizarov, from Patna, Bihar, and the Joint Secretary of Asami, India.
Thank you and good afternoon, Dr.
Thank you very much. Dear viewers, we all know that the magic of Ilizarov. We can treat everything by Ilizarov. Today, we have two parts in our program. The first part is the presentation and the introductory speech regarding Ilizarov from the magnificent presenter, Professor Mofakhkharul Bari sir. And the second part is a very interesting part. That is the journey of Ilizarov, the experiences of the legendary academic panel. I hope you will wait till the second part. Now, I would like to request Professor Mofakhkharul Bari sir, who is the real Ilizarov lover, not only the Ilizarov surgeon, as because of he spread the love of Ilizarov all over the Bangladesh, as well as all around the world also. So I'd like to request Professor Mofakhkharul Bari sir to start his presentation regarding our topic, bone tumor, as well as the introductory speech of 100-year celebration of Ilizarov around the world. Professor Mofakhkharul Bari sir, would you please share your screen with us?
Mm-hmm. Mm-hmm. Okay, share the screen. Okay. Can you see my slide?
Yes, sir. We can see your slide clearly and we can hear you loudly. You may proceed, sir,
Okay, and you
please.
can see me also, eh?
Yes, sir. Everything is fine.
Good. Fine. So I can start, eh?
Yes, sir. Yes, sir. Definitely.
Respected all my good fellows. We are two from Bangladesh, President and the Secretary of the Asami, and our Director of the Nitor, Professor Gani Mollah, my teacher, my mentor, who was the director for 18 years, Professor V.I. Shevtsov, Vladimir Ivanovich Shevtsov. Vladimir Ivanovich Shevtsov, я очень рад, что вы здесь сегодня с нами присутствуете. Я утром вам позвонил, и когда я ваш голос слышал, что было очень так, не могу сказать, выразить, что я вижу ваше лицо сейчас. Спасибо большое, что вы здесь. And Professor Harshad, Professor Fadel, he was here, Dr. Shamsuluddin, and Novikov. Today I would like to talk on the Ilizarov. Whenever I talk about Ilizarov, I cannot express my, inner part of my body. I always love to do the Ilizarov, and the Ilizarov, the man who has done a lot of things for the human beings. And today we are going to observe our Ilizarov 100 years. And the man has done a lot of things for the human beings. This is the orthopedic capital. We are very much happy that this is our institute in Dhaka, 1,000-bedded hospital. Now this is my place where I'm working in the two places here. And this is my center. This is Ilizarov, the 4M, man, meat, method, and the magician, and orthopedic inspiration, a miracle of nature. Now, if you look at this, see the location of the Kurgan, 3,000 kilometers from the Moscow. The Ilizarov method has established itself as a powerful technology for the management of a great variety of bone diseases and conditions. It is considered by us as a system that is based on biological laws and technological philosophy. Basic principles of Ilizarov philosophy were stated by founder of this method. Tension stress effect, that means slow and steady traction on a living tissue, creates a stress which is metabolically activated and which stimulates histoneogenesis. And we should have to know the adequacy of blood supply and loading. Gradual lengthening and correction is the fundamental principle of Ilizarov methodology, and possibility of full-time control of the callus formation. And early limb functioning and loading is very important of Ilizarov methodology. Gabriel Abramovich Ilizarov, a Russian orthopedic surgeon, Russian Academy of Medical Science, the inventor of the Ilizarov apparatus, the founder of the famous Russian Ilizarov Scientific Center, Restorative Traumatology and Orthopedics. Now you can see, born in 1921, 15 June, the day of Ilizarov, and he lived for 71 years. And 24 July 1992 passed away. 1943 he was graduated. 52 he talked about the transosseous compression destruction osteosynthesis. And in 1968 he did his Ph.D. and the same sitting the decision was taken by all the orthopedic surgeons and the members of the scientific committee. They accepted same dissertation for Doctor of Medical Science with author's apparatus. And In 1969, they have given him the Doctor of Science. At the same sitting, 68 and 69, Ph.D. and D.SC. In 1970, a symposium was held in Kurgan with all Soviet traumatologists and orthopedicians regarding this transoceous compression distraction osteogenesis by Gabriel Abramovich Ilizarov. And you can see here with very great leader, Cuban leader, Fidel Castro. And you can see in 1976, all Soviet conference was held regarding his distraction method and compression method. In 1983, there was a conference, international conference in Italy regarding the Ilizarov apparatus and the method. In 1984, conference was held in Italy, and Asami was formed in 1985. In 1985, with the country of the at that time, now today more than 65 countries of the member of the Asami. At that time, France, Belgium, Portugal, Mexico, and Yugoslavia. This is the musician of Kurgan. You can see he lived for 71 years. If you look at this, here this is the Shevtsov, this is Draw Palais, this is Ilizarov. And see sequentially different photos with Ilizarov thinking about. And he worked with this method 40 years. And he worked in Kurgan for 21 years. In 1992, he published a book that was English. That book was in English, 8,000 cases, 656 pictures with 3,100 illustrations. And these are the awards and honors from Russia and outside Russia. These are the international awards. And he became very well when he treated Carlo Mauri from Italy. And this is the family, Svetlana Ilizarov, daughter. And in the right side, you can see Alexander, son of Ilizarov. This is, you can see here, just a little bit. Here, after treating the Carlo Mauro, the method is spread to Italy when he successfully treated Italian journalist Carlo Mauro in 1980 for an infected tibial non-union. He was operated 20 times in Moscow, and ultimately he went to Italy. He went to Kurgan, and the Professor Ilizarov treated it, and that was a key factor that made him famous throughout the world. Now you can see the Professor Ilizarov, the Michelangelo of orthopedics, is talking with the Carlo Mauro and Senkovich here. The extraordinary theory and principles he developed for the treatment of bone are of even greater significance than his instrumentation and devices. His first model, you can see the old model of Ilizarov. First patient, when he treated, he did the arthrodesis of the knee. And this is his graveyard. What are the contributions of Ilizarov? First, biologic law. That is very important. Law of tension and stress. I stated it earlier. The slow and steady traction on a living tissue creates a stress which is metabolically activated and which stimulates histoneogenesis, tissuegenesis, osteogenesis, neurogenesis, myogenesis, everything. In a nutshell, all genesis. And second biologic law is the shape-forming processes acting upon bone tissue are dependent upon the magnitude of the applied load and the adequacy of blood supply. And very important is the method of corticotomy. How to do the corticotomy, Ilizarov taught, and that gives a very important impression all over the world regarding the compression corticotomy. And the third one is the destruction and compression. Destruction osteogenesis and compression osteogenesis, and of course, thousands of and myriads of instruments. And the procedure and the first apparatus Ilizarov designed for it was inspired by the shaft bow. You can see here harness on a horse carriage. Originally, bicycle parts were used for the frame. Horse in harness with the shaft bow, you can see here, decorated with arch standing behind the horse's head. and that helped him to create the Ilizarov apparatus. And this is the car which was used by Gabriel Abramovich Ilizarov in front of the museum. And this is the 850 beds hospital, 18 departments, 24 operation theaters, more than 350 orthopedic surgeons as employees, and more than 1,500 ancillary personnel. So this is the center, orthopedic capital, where a lot of research was going on animals and other different types of animals. So this is the view of the Ilizarov Center in winter and summer. This is the front gate. Ilizarov Center and Museum was opened by great Professor Vladimir Ivan Shevtsov in 1993, 15 June. He was the director of that time, and who was the director for 18 years in that center. And the Ilizarov method, achievements and prospects, that was dedicated to Gabriel Abramovich Ilizarov and future of the method. In the C, you can see the left side, my books in the Ilizarov Museum. So this is the where Professor Ilizarov was working on that chair. Just I'm sitting here. His invention has indeed restored the joy of life to thousands of patients around the world. So this is the Ilizarov Museum. Now there are a lot of changes are there. Every year changes are adding there in Ilizarov Center. This is, you can see the room where Professor Ilizarov was sitting, and with Ilizarov apparatus, patient can drive and easily take that apparatus without any hesitation. So this is the center, and this is with the world famous, Maurizio Catagni, who was the first man who introduced Ilizarov method in the Eastern world. This is Dror Pele with Gabriel Abramovich Ilizarov and Professor Shevtsov in Dhaka. And Shevtsov was talking when he was the director of the institute, and very nice man, very learned orthopedic surgeon. He was the director of the institute and disciple of the Ilizarov. This is, after the Professor Vladimir Shevtsov, Guvin was the director for 10 years, from 10th October 2010 to 11th October 20. So we have a very good time when he was the director of the institute, and he came to Dhaka also. And new director, Alexander Vladimirovich Borsov, who has been taken the charge from 11th February last year. So this is the, you can see the Ilizarov apparatus in the dark. They are doing all the time the experiments for learning the Ilizarov technique, philosophy, and methodology. There's a Professor Khudyaev. He died long ago. He was with the Professor Shevtsov that did a lot of scoliosis correction in Ilizarov Center. So look at this, and how to remove the apparatus in the spine and deformity correction of the spine. So these are the pins, how they are removing this, and there is a special cord for these spine patients. That is in the, you see the animals, so the Ilizarov apparatus, and in the animal center, clinic for animal trauma. And Ilizarov method is not hard to learn, but it does take proper knowledge, effort, devotion, patience, practice, meticulous, intelligent follow-up. Of course, basic understanding is very important, and today it has gained a strong foothold in Bangladesh. And in 2013, 8 years back, they conferred me as a distinguished, that is their calling this honored professor and visiting professor of the Kurgan Center in 2013 in June, 14 June. So these are my, student life career in Kiev. Professor Gabriel Abramovich Ilizarov, my friends, And this is when I was working in Kurgan with different colleagues. This is Dog Square. Academician, you can see this was a rival of Ilizarov from CITO, Central Institute of Moscow. And this is, you know, Harshad, pediatric orthopedic surgeon with my daughter and my wife, Harshad. And when we are doing Ilizarov conference in India, these are the well-known from Indian Ilizarov surgeons. Harshad is also here. And this is Katagni, Gamal Husni, and we're in the Professor Shevtsov's house. These are the, you know, memories of those who are doing Ilizarov with all these great fellows. Rose Brook from New York, Junjunwala, and our all Egyptian friend, Canadian friend, Rod Fellow, and these are all Ilizarov fellows from different parts of the world. So, stalwarts of Ilizarov, you can see here. This is in Brisbane. The meeting was conducted at that time with the presidents of all the countries of the world, almost. And I would like to pay attention, tributes to this great man, 15 June. Every year we are observing that. Now, 100 years of Ilizarov birthday we are celebrating in our country. If you think about the deformities, Ilizarov, pre-Ilizarov era, the only available technique for correction of the limb deformities were, number one, acute correction. There was no satisfactory treatment of severe limb deformities. At that time, they were doing nothing, prosthetic fitting, amputation. And in 1950s, Ilizarov popularized the principles of gradual destruction osteogenesis. That I mentioned you, the law of tension and stress. There was no deformity that could not be addressed with Ilizarov circular fixator. And this is very important. Ilizarov fixated and his biological principles of gradual destruction revolutionized the management of limb deformities. Dear friends, you can see here, limb length discrepancy, bony and joint deformities, soft tissue contractures, boneless, delayed and non-inues, infections, transverse distraction, and ischemic limbs. What are else in orthopedics and trauma you can see here. With this method, fantastic method, you can cover all these things. Now, if you think about the Ilizarov legacy, see legacy circular fixator. This is our athlete, Bangladeshi athlete lady with a stress fracture. I treated her, see, 5 feet 7.5 inches long. Principles of destruction. You can go for this, and this is final, you can see here. Now, newly formed regenerated bone, unique in vivo tissue engineering techniques. No other available technique could form new bone. Unlimited quantities you can get. Same micro and macro structures are native bone, and it is always vascularized with stimulus, simultaneous regeneration of all soft tissue. It is very important you can get with this fantastic technique and unique technique. Now, dear friends, you would think about this congenital LLD where the deformities are main problems. Ilizarov, in your hand, you can solve this kind of deformities. No other alternative ways except Ilizarov you can do. And think about these upper limb deformities. So what happened here? See, now gradually you can correct. So you can see the beautifully correction of this one. Now, gradual correction of severe angular deformities with or without lengthening, you can see here from he is a teacher of a government college, BCS cadet. Now, from this situation to this situation, you can do all these things with biocompatible thin wires and the Ilizarov technique. Now, lengthening dwarfs. I don't want to tell more about this one. You can see from this situation, you can do that. And gradual correction of severe angular deformities through soft tissues or through osteotomies. From this situation to that situation, you can do that. And true Ilizarov legacy is not only the contributions he made about 70 years ago. Most importantly, colossal stimulus, that was huge stimulus that was addressed by Alexander Gubin in 2016, that we can improve on what he left. This is his real legacy. To reach new heights, nothing is impossible. Everything is possible by this technique. Now, what has Ilizarov taught me? There is a solution for all kinds of bone joint problems. The principles for all devices are the same. And the principles and biological parameters was given by the Gabriel Avramovich Ilizarov. Newer is not necessarily better. A tension K-wire is an amazing device to respect the vascular anatomy. And of course, this is a minimally invasive surgery. Traveler, there is no path. The path is made by walking. Does the Ilizarov magic have limits? See, look at this young girl with the right ankle and foot. He was supposed to go for amputation. Now look at this. Now she is a master degree holder. So Ilizarov magic had no limits. Fundamental principle, basic technology, and advanced technology, then you can go for these kinds of deformities. And finally, my learning points are, Ilizarov is a giant in orthopedics. His principles of destruction osteogenesis have revolutionized the management of limb deformities. His true legacy, however, is a continuous stimulation and in inspiration that his contributions have on the medical and scientific community to study, to discover, innovate new areas in the management of limb deformities, to continue basic science, clinical research in the field of bone deformities. And my message is, all of us should try to visit RISC RTO once in a life. The Ilizarov technique, the property of the whole world, and our task is to promote it. This is the man written in here, in his graveyard here in Russian. I have translated in English. See the great scientist, talented doctor, gifted innovator, creator of the apparatus of transosseous osteosynthesis, academician, Russian Academy of Medical Science, Professor Gabriel Abramovich Ilizarov. In medical science, not in orthopedics, the only one man who has created the apparatus and the techniques and given the principles, the philosophy by which we can do whatever we like. Whatever we can do, we can serve the poor people, even the rich people, any kind of deformities, any kind of trauma. And we stand on Ilizarov's shoulder and will continue our effort. See, a physician must observe nature, learn from it, and to be able to rectify its flaws. This talk was given by Gabriel Abramovich Ilizarov. And it is my dream to visit Ilizarov Center since my residency. Ilizarov Center is the origin of deformity correction, limb lengthening, and pediatric orthopedics and treating osteomyelitis. I have given my best efforts to learn and acquire Ilizarov technique, and Ilizarov Center has guided me towards achieving my goals. So in my country, we are happy. Our director is here. We have a unit, deformity correction, Ilizarov lengthening in Nitor. He is the chief of that unit as well as the director. And we can proudly say that in my country, we can show our talent regarding this Ilizarov technique. And I joined in government service '86. I bought 2 kits of Ilizarov external fixator from Kiev, capital of Ukraine. Started producing instruments in Dhaka through errors and trials in all Bangladeshi major clinics. Now carry home message. I love to show this one. Why? I have evidence. I have a science. And I have a surgical skill That's why technology is very good for machines like computers and telephones. But in human being, we need to go a step further. That is called biology. And thus all technologies have to be biologically oriented. In us, let us see the leaders in advocating biological and cost-effective techniques the globe might appreciate, and we can do that. And these are my publications, and I always pay respect to right side. You know, I keep this one with Professor Shevtsov and Professor, these two when we became the honored professor of the Ilizarov Center. And these are the things that I have shared with you. Thank you so much for giving me the time for talking on this Ilizarov. I hope this is for this Ilizarov life sketch. I showed you a little bit.
Yeah. Thank you. Thank you very much, sir. Thank you for your great
Tanvir,
speech.
probably,
Yes, sir.
you stop that one because we are running late. So
Yes, sir.
you give the mic to other people.
Sure, sir. Sure.
Okay.
Thank you, sir. Thank you very much for your great speech. And we came to know many things regarding the journey of Ilizarov. As because of we have some constraint of time, we are going to the second part of our program, that is the sharing of experiences and the sharing of knowledge regarding the Ilizarov. Before that, I would like to introduce one of our academic panel who just joined with us. Uh, he is the man from the country where the Nile is, and from the man where the pyramid is. The Professor Mohamed Fadel, sir, director and founder of Limb Reconstructive Surgery, Mina University Hospital, Cairo, Egypt. Sir, welcome to our show, Orthopedic Solution
Uh,
Academy.
Thank you so much. First of all, I would like to thank you and say greeting and regards for our friends, all of you, one name by name. All of you are closely related for myself, and I am so happy that Professor Bari gave me this chance to give in 5 minutes, as I promised him, for presentation for my impression about Ilizarov, which by myself I think it need a long time, but I hope that in these few minutes share this chance with my colleagues all over the world. I will try to share. Is it okay or not? Not yet?
Not yet.
Not yet, sir. Please share your screen. We are waiting for that, sir.
Is it okay now?
Coming.
Yes, sir. It's coming. It's coming. No. No, sir.
Actually, I didn't feel this problem with Zoom. Maybe this is the first time to.
Yes, yes, coming.
Yes,
Already.
yes, yes, sir.
Okay,
It has-
okay,
Yes,
okay.
it is.
That's okay. Thank you. Now it's okay.
Now, the previous slide was okay, sir.
Okay.
But no, sir. It's not okay, sir.
Huh?
Now it's okay, sir. It's okay.
It's okay.
Just
Okay.
it's okay. Yeah.
It is a chance to start. Thank
Yes.
you, and I am very sorry for this delay, but I will be in a hurry. Kind regards and greeting from all over the Nile and all over my country, and I can say that it is a very nice chance to present this regards from Egypt at all, Egyptian Orthopedic Association, Reconstructive Surgery professional diploma, and thanks for my dear friend Professor Bari, who gave me this chance, and usually he succeeded well to make a gathering for our beloved Ilizarov, and thanks for this elegant panel. I'm happy to be with you in this meeting. And thanks also for the corona, which we have at least one benefit, is to gather us from all over the world in a specific time, anytime we would like to meet. Thank you. So also thanks, we started in the LRS, the hybrid version, because we are obliged to do it. Talking about Ilizarov, I was astonishing. How can I start to talk about the pre-Ilizarov era or the post-Ilizarov era, because it is mandatory to know where we were before Ilizarov, to know how much we are nowadays after Ilizarov. Going in a hurry, to talk about Ilizarov, the person or the human being or the apparatus or the principles and the concept. I think that Professor Bari covered very nice the history of Ilizarov as a person and a human being. I would like to stress that this human being have a foresight to discover what had been considered the era pre and post Ilizarov. And the historical review, I think even me or Professor Bari on many of our colleagues can do present it to save time for next experience, and for giving a chance for, I think, many of our colleagues and the trainee are watching us to take a benefit also of your experience as a very excellent panel now. So the Ilizarov is not the human being also, but Ilizarov is apparatus, which give us many chances to do many things that some of them had been mentioned by Professor Bari and other colleagues. And the most efficient and the most serious one is that the distraction histogenesis, or sometimes distraction osteogenesis, that had been mentioned by Professor Ilizarov. This gave me the chance to say that all these difficult things had been managed carefully and silently by conservative management of Ponseti and his City book. In my mind, I'm considering that the counterpart of the surgery, the conservative surgery, is that of Ilizarov. I consider that Ilizarov also is the minimal invasive surgery, is the green-white surgery, is the green-white surgeon. So I think that the most conservative surgical procedures, I think in my mind, is an Ilizarov apparatus. He gives the chance for doing all these things via all these complicated things, but the result is the benefit of the patient. So how to say thanks for Ilizarov? I think as mentioned from the last words from Professor Bari, to go at least once for this area, which was in 1950. Looks like this area full of snow, but later on after Ilizarov, it looks like was very efficient to have a look, at least even one year life. I was lucky to be there in, I think, the 60th anniversary, invited by our friend Professor Shevtsov to associate them in 2007. With all these are in love with Ilizarov philosophy and Ilizarov principles from all over the world. I didn't like to mention one of them, but all of them are a friend of me and all of you as a panel. And the change of the snow area to have this building, and I have the honor to have a photo in these places with our team from Arabic countries and from Egypt and from the interior of the institute, and have a very nice journey in the office of my dear friend Professor Shevtsov, in his office, to give me the chance at those days about his idea about the minute by minute, or maybe a nano minute of lengthening apparatus at that time. And he mentioned me that since long time Ilizarov know this well, and he also encouraging to have all these innovation in the Ilizarov apparatus. And he gave me the chance for many minute things, and we have a very nice tour for the institute, for watching many of the marvelous cases. And since that time we are enjoying, and we are very proud to receive many of the team of Kurgan to associate us in Egypt with the deformity correction course that had been elaborated by Professor Jamal Hosni. And since 2005 we start annually to have all those. So how to say thanks to Ilizarov? This is one, is to visit Ilizarov to know how there is this. Also to design some programs for management of principles and using Ilizarov, such as the centers all over the world. And I would like to recommend that one of Professor Bari in Bangladesh, and design some mini courses for those of the low-income countries, friends from Africa. We invited them to share us in Cairo and the LRS. And also we can say that we can say thanks for Ilizarov by also joining any collection and to talk for this panel postgraduate with my friends from India, to associate them and to present for them for this one. I present what we can do by Ilizarov principles in the management of congenital food. I don't like to, I have many things to say as a director of Africa for many organizations all over the world, as I am the infection subspecialty director for Africa and CCOD, and also director of Africa and the World Against Infection and Orthopedic Trauma, and vice president and of Professor Tanija, and director of Africa also for the World Orthopedic Concern, and the Arab Orthopedic Association for the website. And as I would like to say that I am the program director of LRS.PD, and actually we can say Ilizarov, to say for Ilizarov thank you, and thanks for Ilizarov by disseminating and propagating all over at least one of our lovely places here in Africa, and also ask our friends to do this in their area. And actually I have many slides, many talks, many ways to say thanks for Ilizarov, but I would like to stop my presentation to give the chance, as I told, for many of the trainees to follow us and to have benefits from your experience, our associated dear panel. Thank you.
Thank you, sir. Thank you for your brilliant presentation. And now I would like to say something, as because of Professor Bari sir says that you need evidence, science, and the surgical skill. But I think more than that, you have some passion, and you have to love the Ilizarov for the betterment of the Ilizarov. As because of it is not how much you do, but how much love you put into the doing that matters. And we love Ilizarov. Now, I would like to request our honorable academician, Professor Shevtsov sir, to say something regarding the 100-year celebration of Ilizarov and the experiences of his golden moments of life. Professor Shevtsov sir, would you please share your golden experiences with us?
I think I should do stop sharing, I think, or is it already?
It's okay, sir. No problem, sir.
Okay.
Stop sharing. Professor Bari sir, would you please tell Professor Shevtsov sir to say something?
He's trying, probably. Vladimir Ivanovich, говорите. Unmute.
Of course, you have to unmute
He's talking,
yourself,
but
sir.
he has not done unmute. Hey, unmute. Please unmute your microphone. Vladimir Ivanovich.
Tell him in Russian. Talk to him in Russian.
Ivanovich. Микрофон не слышно. Не слышно.
Не слышите меня?
Да, сейчас слышно. Давай.
Я могу начинать?
Да, начинайте. Говорите, начинайте. Вы по-английски будете говорить или по-русски?
По-русски.
Покажите слайды.
Я буду по-русски, а вы по-английски. Хорошо?
Да? Я должен переводить?
Да.
Тогда медленно говорите. ও পারমিশন যাচ্ছে, ও রুস্কিতে বলবে, আমি ইংলিশে ট্রান্সলেট করব।
It's okay, sir. No problem.
It's okay?
No problem.
Okay.
Послушал эти два сообщения профессора Бари и профессора Фаделя. Я должен сказать.
I want to show you the two informations of Professor Bari and Professor Fadel.
Я должен сказать, что я засомневался, где же родился и жил Илизаров.
I was in confusion where this Ilizarov was born.
Вы настолько подробно рассказали о жизни Илизарова, особенно профессор Бари, что я даже некоторые факты не знал, а вот теперь знаю после выступления Бари.
I am astonished how Professor Bari knows about the Ilizarov. Even I don't know a lot of things about Ilizarov.
Да, Илизаров это для настоящего времени это эра Илизарова в травматологии и ортопедии.
This is the era of Ilizarov in traumatology and orthopedics.
Он полностью перевернул всю травматологию, особенно ортопедию, в плане возможности оказания и расширения специализированной помощи.
You can help anything in traumatology and orthopedics by Ilizarov technique.
Ведь для Илизарова были попытки удлинения конечностей. В Германии еще в 20-х годах были разработаны аппараты для возможности удлинения, попытки удлинения конечностей предпринимались.
In Germany, before Ilizarov, they tried to go for lengthening, but they could not.
Но все эти попытки закончились одним – ампутацией конечностей после подобной операции.
What they have tried in Germany for lengthening and what happened ultimately they did for amputation.
Почему это произошло?
Why this happened?
Потому что никто не учитывал биологические закономерности развития организма.
Because nobody knows about the biological laws that was shown by Ilizarov.
В 20-х годах прошлого столетия в Германии, когда предпринимались попытки удлинения конечности, то это выполнялось одномоментно на операционном столе.
In 20th century, whatever they did in Germany, one time they did the lengthening. That happened, ultimately it goes to amputation.
И в результате происходило нарушение кровообращения, нарушение
And
иннервации.
as what happened? Loss of distraction, loss of blood circulation, neurological problem, and they did amputation in the same table.
Развивалась
One time lengthening.
Развивалась гангрена и производили ампутацию конечности.
And what happened? As a result, gangrene was there, and they decided to go for amputation.
Заслуга Илизарова состоит в том, что все свои новые идеи он не начинал применять в практике, в медицинской практике, пока не производил соответствующие эксперименты на животных.
Why this has happened? Whatever Ilizarov done anything in the human body, he did everything in the animals. That he proceeded for human being.
Вот, скажем, в травматологии, какие особенности имеются в травматологии при лечении переломов?
Now think about the trauma fracture of the long bones.
Он провел специальные исследования, которые касались жесткости фиксации. Видно изображение? Нет? Изображение не видно?
He did experiments with stable fixation or near stable fixation in case of trauma patients.
Вот для этой цели он провел 3 серии экспериментов. В одной серии одна опора на каждый отломок, 2 спицы не натянутые. В другой серии 2 спицы натянутые. А в третьей серии по 2 кольцевые опоры на каждый отломок с натянутыми спицами.
Это очень трудно, Владимир Иванович. Вы много так говорили, я не могу.
А изображение не видно? У меня сейчас изображение, там не видно у вас?
Да. Хорошо, говорите.
Слайд у вас не видно?
Слайд нет.
Ну что тогда?
He's showing the slides, but you cannot see.
Ну ладно, хорошо. Значит, он провел...
The slides. Can you see the slides?
No, sir, we can't. We cannot see the slide, sir. He has to share the slide first.
Slide.
Вот у меня слайд здесь, передо мною.
Нет, мы не видим. Пожалуйста, покажите еще раз.
Значит, он провел исследование значения жесткости фиксации при переломах.
Stable fixation is always mandatory in case of fractures.
При плохой фиксации отломки имеют маятникообразную подвижность. В результате развиваются замыкательные пластинки.
If your fixation is not stable, you will get movement, and as a result, you cannot invite lot of callus.
А при жесткой фиксации заживление перелома происходит по типу первичного заживления, как в мягких тканях, минуя фиброзно-гостевую стадию.
You can get good healing. Владимир Иванович, где ваши слайды?
Вот передо мною.
Не вижу.
Ну, вот, а так, видно? Не видно?
উনি ওনার স্লাইডগুলো দেখে, কিন্তু আমরা দেখতে পাচ্ছি না বলতেছে.
Окей. Вот таким образом, проведя эксперименты, Илизаров отработал технологию удлинения конечностей. Вот это его самая большая заслуга, что он научил мир, как надо удлинять конечности.
What he did the experiments on animals for lengthening of the bones. And that was his main motto. All the time he did the experiments for lengthening of the bones. He did experiment primarily in the animals. And then he has applied this experiment in the human body.
И от удлинения одного сегмента одной конечности он затем перешел к системным удлинениям, когда необходимо увеличить пациенту рост. То есть сначала один сегмент мы научились удлинять, а потом начали системно удлинять все сегменты конечности для увеличения роста.
And listen, what he did, he lengthened one segment primarily fast, and then step by step he had done a lot of lengthening in different parts of the body.
Затем дальше произошел заказ пациентов. От удлинения длинных костей мы перешли к удлинению коротких костей кисти и стопы.
After doing the long bones lengthening, he has gone for short bones lengthening. That is in the hands and in the foot.
Илизаров говорил, что аппарат настолько универсален, что он может использоваться при нейрохирургии, в ангиологии, в онкологии и других дисциплинах, медицинских дисциплинах.
After doing that, Ilizarov said you can apply Ilizarov urology, in cardiology, in geriatric, everywhere you can apply Ilizarov apparatus.
И поэтому после смерти Илизарова у нас было открыто отделение нейрохирургии, сосудистое отделение, где лечились соответствующие больные.
After death of the Ilizarov, we opened the neurosurgery in Kurgan and vascular surgery in Kurgan for lengthening this, all kinds of by Ilizarov technique.
В целом же Илизаров был заточен, он был нацелен на новые идеи в травматологии и ортопедии.
He has given the new idea in traumatology and orthopedics.
Он исключительно гениальный человек и
exclusive genius.
Да.
He's telling Ilizarov is exclusive genius.
И своей богатой фантазией он притворил травматологию и ортопедии и подарил это всему
And he
миру.
was rich in thinking all the time. So much rich in thinking all the time.
Поэтому итальянцы сказали, что в России с появлением Илизарова произошла вторая революция. Революция
And other
травматологии и
people, that's why
ортопедии.
they told the Ilizarov, that is second revolution in Russia, due to Ilizarov.
Достижения Илизарова настолько важны, что об этом свидетельствует создание ассоциаций по изучению аппарата Илизарова в 55 странах.
And achievement of Ilizarov is very great. And that's why different countries now are trying for doing this Ilizarov technique. It's so?
Поэтому Илизарова мы все знаем, любим и будем всегда помнить. Он навсегда останется в наших сердцах и в наших мыслях.
That's why we all love Ilizarov. We are following Ilizarov technique and everything what did Ilizarov. So,
Спасибо за внимание.
thank you for your attention.
Attention.
Thank you, sir. Thank you for sharing your experiences with us, and thank you, Professor Mofakhkharul Bari, sir, for translating. And now I would like to request Professor Harshad, sir, to share his experience of journey regarding the Ilizarov. Professor Harshad, sir, would you please?
Yeah. How do I copy this onto this? Share? Should I click share?
If you want to,
I'm sure you have to click.
Sir, you have to just click on share
Slide
screen.
presentation. Go to
Yes, sir. And share your desktop or your slide, whatever you can see, sir.
share video file, share screen.
Share screen and then open your presentation, sir.
How share screen? No.
share.
There is a share button in the bottom, sir. Just click on that.
There is yes, sir. There is a share button in the bottom, sir.
Yeah. You're on the show.
Yeah.
Stop sharing. Is it coming? No.
No, yet not coming, sir.
Yes, sir.
Yes, it's
Sir.
coming.
It will open on my this one.
Please go full screen, sir. Please go full screen. Please run the slideshow. Don't close it. Please run the slideshow, sir.
My slideshow is open.
Yes, sir.
Is it open there?
Just close. Don't go to preview, sir. It is open, sir. Just play it full screen.
Okay.
One
One
second. Full
second.
screen.
Click screen. Now?
Yeah. Full screen, sir. Yeah. Come, sir.
You are all able to
yes,
see?
Yes, sir.
Yes,
It's
sir.
perfect.
I'm not able to
100%
see anybody
perfect,
except
sir.
my presentation. So if it is okay, shall I begin?
Yes, sir. Please.
Okay. Dr. Bari, thank you so much. Dr. Mohammad Fadel, Dr. Abdul Gani Mollah, all close friends of mine. Professor Shevtsov, who is my mentor and teacher and fine tuner of mine. Professor Novikov, Konstantin had come to Bangalore also to conduct the cadaveric workshop here and operate on my family members as well as others. Dr. Jiancheng ZANG at China, taken very good care of us, and we had a wonderful time. Dr. Mohammad Iqbal, and finally Dr. Mohammad Tanvir Ashraf. Thank you so much for everything. I know it's taking time. A small video I will play so that all of you, in the meantime, I'll just talk to you. Dr. Bari has already, this is a humerus, infected non-union. The commonest place where we use Ilizarov is on infections of long bones. Whenever there is infection of long bone, it is very difficult for us to treat. We cannot put any implant inside, because the implant itself will produce infection. So that is where Ilizarov, which will allow us to excise the infected bone, so infection can get controlled. Earlier, infection was never controlled of bone. Before Ilizarov era, or before Ilizarov came into the picture, all of us were taught that chronic osteomyelitis, which means infection of bone, is the volume. I'll reduce the volume. I do not know. All right.
We can hear you, sir.
You can hear?
Yes, sir. So we
Okay.
can hear.
What
Yes, sir.
happens is, when you put the Ilizarov on, everybody objected, saying that this particular fixator is not good for patients. It is not a humane method of treatment. All of them, okay. That reduces the background sound. Can you hear me now?
Yes, sir. Clearly,
Hello?
sir. We can. Yes, sir. Yes, sir.
I'm
We can
sorry.
hear you clearly,
Okay,
sir.
so you can see that this boy is quite comfortable with this Ilizarov external fixator with many pins inside his arm. He's able to move. He's able to drive a motorcycle, and you can see on the net, and you can see in Russia, and all of us have got patients of all kinds of Ilizarov fixed everywhere, and all of them are doing good amount of this one. Initial few days, some pain is there, which we get it controlled. So the most important was trying to get pain controlled, convince the patient that we will do a good job, because conventional treatment cannot treat all such conditions at all. And this is where Ilizarov comes in the picture. And finally, if you see, 80% of orthopedics can be treated primarily by Ilizarov itself. Look at this. I don't think we ourselves can do so much of exercise, isn't it? So starting with this, I think, okay. So we are celebrating 100 years of Ilizarov. And well, Drashtvite to everybody, Namaskara, good afternoon. We too have become small magicians, not as big as Ilizarov, but then we too are able to do magic surgeries. I come from Ramaliah Medical College and Memorial Hospital, Bangalore. He's the true magician. He's the one who invented and found these external fixator rings. After him, I think about Professor Ilizarov, Dr. Bari has elaborated and told a lot. That's why I have not included much. Next is Professor Shevtsov. He was with Dr. Ilizarov for, I think, 25 years. And after that, he was director for 25 years. He has become an academician and a big man and a very close friend of mine. Thanks to Dr. Bari. And, well, my salutations to Professor Shevtsov. Even at 75 years, hundreds of surgeries he has done, I have assisted, I have learnt a lot. Excellent surgery. He's a very good, friendly man. And it started at other conferences, international conferences across the world, and also at Bangladesh, one of our first meetings in 2008. Of course, China, Dr. Zhang is here. Dr. Qinsibe, they took very good care of us when we were there in China. This was when they came to Bangalore, Mysore. Of course, Dr. I'm here. All are stalwarts. Dr. Zhang here, who had come to Malaysia, and we meet there. I have been conducting cadaveric workshops in Bangalore. Dr. Manish Dhawan, Dr. Bari, all of them are here in Bangalore. All these youngsters have, all of us have become old, many of them. He's Dr. Sandeep Reddy, Dr. Ashok, Dr. Karan, all of them. These few of them have been trained in Bangalore. He's from Delhi. He's from Puttaparthi. This is Dr. Bari, you know. So like this, all over the world, we have met. Dr. Gani Mollah, you look very young here. Excellent. And then you can see after conducting many of these things, Dr. Bari has always been part of our programs in what we conduct at Ramaliah in this one. So there we have got cadaveric workshops where Ilizarov limb lengthening is there. After Ilizarov and Professor Shevtsov, Dr. Drolpeli came into our picture and he changed a lot of things, the concepts and thinking and all those things, along with Herzenberg. Dr. Drolpeli also started the first thing which I liked very much was he reduced the number of complications just by changing the names, saying that the others were problems and not complications. Well, Dr. Novikov is here with us. I wish he was here with us in this meeting. Along with Bari, they have come and operated on one of my family members. Dr. Sandeep Reddy is here, who is another Ilizarov man with 15 years plus experience. In my department, I have trained 2 of them, and we have 15 years plus experience Ilizarov surgeons, 3 of them in my department. I don't think anywhere in the country we have. So with that, I think we can stand at least in the top 10 in the whole country, only because of Ilizarov methods of treatment. And Dr. Bari has put one of my whole program in his hospital, what I call ABC IPL, Advanced Cadaveric Learning Center, in our center, the whole thing. He has put all the photos across the world, whatever he has done. I picked up this from Bari. Of course, this is from Brazil. I have traveled across the world only because I learned Ilizarov surgery and I had a passion of teaching everybody, and only because I could do magic with patients where no other treatment was possible. And this Ilizarov treatment, of course, across the world, you can see all the countries, all the continents. The technique of training Ilizarov, what is to be done. I have trained more than 200 doctors, postgraduate consultants, foreign consultants. I have been very happy. Once I learned Ilizarov, started treating patients with Ilizarov external fixator with a lot of hiccups in the initial few years, but afterwards we picked up and there was no looking back at all. And constantly we need to update and learn, because more and more difficult cases we are treating with these things. So we have conducted, and this one, our postgraduates have probably got 9 or 10 theses on Ilizarov done. We have more than 300 papers presented, posters, lectures, guest lectures, etc., across the country and across the world. All major institutions like PGI, Chandigarh, here, there, and all that, every place we have conducted meetings and conferences. Before I was president of Asami, India, I was president for 2 years. I saw to it that every place it was there. Shamsul Huda conducted one in Bihar, and now it has become a regular affair. Famous book by Professor Ilizarov, from where I learned a lot of things. Transosseous osteosynthesis is like our Bible. And later, Dr. Bari has written many books, and several other books are also available on Ilizarov technique itself. This technique is so good that other methods, when you cannot treat, you have to amputate or you have to leave the patient alone, you can treat with this and create good thing. My basic aim is, I still see that out of 500 medical colleges in India, we have 450 medical colleges where they do not know how to treat by Ilizarov method. So out of the 50 medical colleges, 40 other medical colleges are treating only very occasionally. So this is the reason my aim is to see that our postgraduates in orthopedics should know the basic Ilizarov external fixation usage. Of course, if they become specialists of some other kind, they can forget this if it is not required, or they can get further treatment, training in Russia or big people like Bari, etc., and all of us, where we can train them how to operate, and we can. Now we have come to that level where we can treat all patients very well because of our 30 years plus experience, as well as we have taught so many people, gone to so many meetings, we know. But then the question always arises, what to do when there is infection? You can see a cavity in a normal bone. The normal bone has become irregular. There are dead pieces of bone. There is pus, dead tissue. This is what happens to bone. So earlier we used to just clean it, put antibiotics. Now we can simply excise this whole thing. So when you excise this, the gap which is there can be filled by Ilizarov's regenerate. What Dr. Bari has already told, histoneogenesis in different tissues, osteoneogenesis, or it is whether it is nerves or muscles or vessels, everything can be grown with Ilizarov technique. A few examples, Bari has shown plenty of them. You can see a short limb can be made long. There it is, a small short limb, a deformed limb. It doesn't have any bone in between. One bone is overgrown, one bone is this one, congenital pseudoarthrosis of tibia. You can treat with Ilizarov, lengthen it, make everything all right, and it becomes first class. There, one girl with very short leg, with a very crooked hip, which was corrected. Then fixator has been put. Oh, I'm sorry, I didn't tell you that. There you can see the fixators. I made these stoppers like that, specially made for this, and then did an osteotomy and corrected this. After correction, this is the femur, which is very small in a small young girl. We cut the bone, lengthen the bone. All right. You can see I have cut the bone here. It is known as corticotomy. I have cut the bone here. It is known as corticotomy. And then we lengthen the bone between the rings. And then the leg becomes longer and longer and longer. This is the femur. This is the tibia, which has become so long and thin in the small girl. In young children, it grows very well. And today, her knee joint is up here. That is the hip joint. This is the knee joint. This is the hip. This is the knee. From here till here, it is one single bone. This girl today walks normally with the hip joint around here. This is with a support. Now she doesn't have any support and she can stand and walk. Only she cannot sit or squat because her knee joint is at this point. There, she's walking. All right, the video doesn't play. All right, you have seen Bari's this one, the forearm, which is very short because of some small benign tumor. We cut the bone, put Ilizarov, lengthen it, and a crooked bone with overgrown bone like this becomes normal. One of my relatives' daughter from Maharashtra. Their very crooked and bad limbs can all be treated excellently. You can see many Ilizarov cases like this. And of course, we get a scope to do a lot of things. So, Pasiba, Shukriya, thank you, all of you. If there are any questions you want me to answer, I can answer. Everybody blames somebody else for Ilizarov failure. Please, all doctors who learn, take the blame onto yourself and see that there are no failures. Thank you so much. I wish all of them very best. I congratulate Russian Center, Professor Ilizarov, on his 100th year here now. And my salutations to Professor Shevtsov, who is here. And Bari, one of my best friends in this world on Ilizarov and orthopedic friends. I thank him so much for helping me out in seeing that our interest and work on Ilizarov works on very well. Thank you so much.
Thank you, sir.
Thank you
for your great presentation.
Yeah. Thank you. All right.
Yeah, it's all right, sir. Now I would like to request Dr. Shamsul Huda, sir, to before that our Chinese friend has joined with us. Before Dr. Shamsul Huda, sir, I would like to request Dr. Jiancheng ZANG, sir, from Qinsibe Orthopedic Institute, Beijing, the Secretary of Asami, China, to share his experiences with us.
Okay. Good afternoon, everyone. Very honored to be invited as online to meet all the friends. I have a small slide. I will share it now. Share it. So I can try. Yeah. Can you see it? The skin?
No, sir. No, sir.
No?
Yet not. It's coming. It's coming.
Now it's okay.
Coming. No, it's not okay. You have to make it full screen, sir.
Just open the presentation. Yeah.
Yeah. Now it's okay.
I think it takes some time to appear.
It has come, sir.
Yes, sir.
Okay.
Come and it's perfectly okay. Yeah.
Okay. This is Jiancheng ZANG from Beijing, China. Before the important day of 100 celebration of Professor Ilizarov, this important day, I'm very glad to be invited to as a speaker in the online webinar. In this time, I would like to talk the hero of the Bangladesh. I share some pictures and in the important day, 100 the birthday of Ilizarov in China. We also have some conference in the live conference or the online conference about the important day in Beijing, in Shijiazhuang, in Changzhou, a lot of place to hold this kind of meeting. And I know several days later in Kurgan, the big conference also be held in Russia. So firstly, I want to say many thanks to Professor Ilizarov. He gave us so many opportunity to meet the best friends and to have some experience to treat the difficult or easy some patient. And 5 years ago, Professor Qin to lead us to Kurgan to meet the lot of friends. On the wall, I looked so many ordinary professors. This is Professor Qin, and here is Professor Bari. I know Professor Bari is an active man in the field of Ilizarov technology. Here is Professor Qin, president of Asami, China. In China, we have a lot of the difficult cases, lower limb or upper limb deformities like this, and the foot and ankle deformities. We collect the data and into one book named Lower Limb Deformities, published last year with Springer. And some cases I just show, even the severe deformities, we also can get good result. We using the frame, just using the fixator. Ilizarov method. So between or among the busy work, Professor Qin usually plays some flute to have some spirit to do the clinical work. In the meeting, we also to see Professor Bari show some similar cases with us. So you can see so many similar cases with us. And we invited Professor Bari and Professor Gubin to China many times to talk how to do, why to do, where to do, some techniques, some philosophies. We have many times to meet each other. And in Liverpool and here in Shenzhen, we just finished a dinner. Here is my son. Yeah, Professor Bari, can you remember that? Like brothers, maybe in half year, we can meet each other 3 times. Yes, so many times. Before the severe COVID-19, Professor Qin and me to Dhaka of Bangladesh to meet Professor Bari's institute. And in his orthopedic ward, we look the patient and we talk in his room, and we perform some surgeries in his operating theater, and learned a lot and talked a lot. And even also before the COVID-19 in the 2019, we invited many professors to found the mentor of Professor Qin. We found the center of special for the deformity correction in the medical university. Here is Professor Bari, and he is Satish, and a lot of friends from the international. So you know that we also treat some foot and ankle deformities combined author. Yeah, you can see everywhere the authors how to do. In this meeting, Road and Bite meeting, we also found another society just for the spinal bifida sequela, Chinese society. And another one is just for the diabetic foot. We have the special society committee for the difficult cases. So you can see here is Professor Qin. He is the president of medical university, and Professor Zhang, and Dropolinki from Russia, and Hani Amawafi from Egypt, and a lot of friends, Satish, and Yung Hong, from Korea, and Donghong from Korea, and from professor from Japan. Oh, here is Professor Bari and his wife. So a lot of nice memories. So when I visited in Kurgan, a lot of things we must think about: how and what and when we can go. Like deformity on foot equinus. So how can we treat it easily? Like Archimedes, he said, have a spot on the even and can control the direction. So we have the special tools. We have the spot and give the direction some continuous force we can control and correct the deformities. So I'm totally agree with Professor Bari. Why Ilizarov? So very, very important. I took the picture and show in this webinar and to talk. So Ilizarov, intelligence, listening, infection, ZANG, and reliable opportunity and visit height. So it's very important philosophy. So in the very important day of 100 celebration of Professor Ilizarov, we must think about where we can go in the future, what we can do in the future. It's a superficial or deeply. How can we don't say no by Professor Ilizarov? Last year, we mainly from Professor Gani and Professor Qin organized a special issue on GOT. Just for the Ilizarov method in China for 30 years, we collected 12 papers published in same time. And this year, just before this week, another journal also has a special issue just for the Ilizarov technique, but in Chinese. China doctor very familiar and with Chinese journal. So the best 3 journal just for the Ilizarov method. And in next weekend, we also have some 100 anniversary celebration of Ilizarov, some summit, forum, or some conference just for the external fixation and limb reconstruction in Shenzhen city in China. So I want to show this video with 55 volts. So you can remember that in Israel, without the tolerable has 49 volts. Yeah, not a big deal. 6th World Congress of Combined Meeting, I.SC, Asami, and BR. Very good opportunity for us. I think also a good opportunity to all of us. 2023 in Beijing, we have a good, absolutely have a good meeting. So you must know that the ancient famous professor Confucius said that what a joy is to have a friend coming from afar. And in the end, I want to say thanks to Professor Bari invite me, and say thanks to all the professors and the doctors, and say thanks to Professor Ilizarov, and give us the opportunity to meet each other, to guide the friend all over the world. Thank you, everyone. Thank you, Chairman. Thank you. Thank you.
Thank you, sir. Thank you very much for your excellent audiovisual presentation. and a great sound effect.
Thank
We
you.
all know that. Thank you. We do not remember days, but we remember the moments, and that were the golden moments of our life regarding the Ilizarov journey. Now, I would like to request Dr. Shamsul Huda sir to share his experience regarding his journey to Ilizarov.
Thank you, Dr. Tanveer. I'm very young in front of our stalwarts that are sitting here. I'd like to especially thank our Professor Bari sir, Harshad sir, who are my real teachers, who taught me at every step, with whom I can come here. I really greet Fadel sir has helped me. I really give gratitude for Shevtsov sir. Ilizarov has been a journey for me. I used to just do trauma and all just before 4 to 5 years, and after the teachings of my seniors, now I'm able to do impossible cases, no limits of thinking. Where all the cases ends, Ilizarov starts. I am doing deformities, limb lengthenings, infections, whatnot. So it's been a real pleasure. I'd like to give I will not make Professor Ilizarov, but for me, Professor Ilizarov is all my teachers sitting in front of me here also, right now. So you are all my teachers, have given me chance to learn and do something. I'm really grateful to you. I'd just like to share one screen, one photograph, if you allow, Dr. Tanveer.
Yes, sir. Please, please.
Yeah. So, can you see the screen?
Yet not, sir. Yeah, it's coming.
So I always keep my Ilizarov box, my armamentarium in all my cases. Whatever trauma I do, this help me anywhere, everywhere. So whatever the deformity is there, whatever type, you can just treat with Ilizarov if you have the thinking. All that type of daily activities is possible with Ilizarov. There's no limit to walk, to do, to work, to play with your hands, with your foot. Everything is possible with this. If you have an experience and learning of Ilizarov, patient can do his earnings, earn his bread at his village, at his office, do everything. So all this is possible with Ilizarov. I really give thanks to all my professors. So I give the hashtag for Ilizarov. The hashtag is Ilizarov Saving Limbs. Hope is always live. These are my several patients I have treated from different states of India, from Rajasthan to Assam. These are my loving mentors who have treated me Ilizarov. I really like to thank them. Thanks a lot. Thank you, sir. Can you stop share?
Yeah. Stop share. Thank you very much, Dr. Shamsul Huda sir,
Thank
for
you, Dr.
sharing your
Shams.
experience.
Thank you, Dr. Shams. Thank you.
For sharing your knowledge. Yeah. Dr. Jiancheng ZANG already said that when we have to learn what we have to learn, how to do, what to do, and when to do, and this is very important for all of us. It is a very important thing that someone says, I don't believe in aging. I believe in forever altering one's aspect to the sun. Now, I would like to request Professor Abdul Ghani Mollah sir, the President of Bangladesh Orthopedic Society and the Secretary of Asami, Bangladesh, and the President Director of Nitor, to share his experience with us. Professor Abdul Ghani Mollah sir, would you please share your experience with us? Professor Abdul Ghani Mollah sir? Yes, sir. Would you please share your experience with us, sir? We are waiting for your experience sharing. Yes, sir, we can hear you, sir. We can hear you, sir, please. Yes, sir.
Tanveer?
Yes, sir, we can hear you, sir. We can hear you. Can you hear us, sir? Yes, sir, we can hear you, sir.
Tanvir,
Yes, sir.
can you hear me? Can you hear me?
Yes.
We can
Yes,
hear,
sir.
sir.
Yes, sir. We can hear you,
Oh, I
sir.
cannot hear anything, anything from you.
Please start,
Tanvir.
sir. We can hear, sir.
Please start, sir. We can hear you, sir. Please proceed on, sir.
Can you?
Bari sir.
Phone coming disturbing.
Tanvir, can you hear me?
Sir, we
Yes,
can hear
sir.
you. You can start speaking, sir.
No, now
But
we
I
can hear
cannot,
you.
hear anything from you.
We can
Now
hear
we
you,
can
sir.
hear
We can hear you, sir.
You go on.
I think there is some sort of network problems there, and it will overcome soon. And we're just waiting for that. I think it's a great day for us, as because of our seniors and professors, all of them are with us today, and it's a great day for the young Ilizarov surgeon also, as because of all of the senior professors and senior mentors are in a single frame, and it's a great day for me also as a young orthopedic surgeon and a lover of Ilizarov. Professor Harshad sir, one of his family members, joined with us, and welcome.
You are going to be more.
Yes, thank you.
Welcome to our show, and thank you for with us.
I'm invitation you in Kurgan. In 15...
We are in Kurgan now, eh? Yes.
15 июня у нас большая конференция будет.
Sure,
Yes,
we approaching June.
Yes.
Yes, the annual June.
15 June.
Yes,
Very
annual
big
June.
conference in Kurgan.
Yes, annual June
Okay.
meeting. Yes.
Finish. Okay, finish.
Finish. Yeah.
Okay, bye.
No, bye.
Sir, I think web. Yes, sir.
Still snow. I think no snow nowadays.
And no snow.
Oh,
Now
sure.
flowers.
Yes.
Very good weather.
Yes, at that time. Yes, I went there at that 2007. It was very nice days.
Sir, what is the favorite food dish in Kurgan, sir?
We have many experienced Kurgan-minded nowadays. We have all the panel can advise you. He asking about when he can visit Kurgan.
Okay, sir.
What is your suggestion for time for our friend?
Now June is the best time. It is summertime there, no?
Sure.
We are still online. Anyway?
Yes, sir. Yeah, we're still online, sir, and we're still live, sir.
Yes.
Hello. Sir has joined with us. Yes, sir. We can hear you, sir.
Listening.
Oh.
There is some problem. এখন কি আমার টাইম নাকি তানভীর?
Yes, sir. Yes, sir. It's your time now, sir.
Okay.
No, lectures are not.
Thank you very much. Spasiba Karashab, to our great magician next to Ilizarov, Mr. Shevtsov from Russia, our teacher, our mentor. And in this August gathering, Harshad is here, Professor Fadel is here, Professor Cheng is here, Dr. Samsuruda is here, and not but the least, Professor Bari, the honored professor, is here, the philanthropist. He is the Ilizarov in this subcontinent, in Bangladesh particularly. So salute everybody in this August gathering. You have many experiences. I have also experiences, but due to the inconstant time, I cannot show any slide to you. So in this August gathering, I am very much happy to see all of you in a nutshell. Very things. For a long time in the COVID situation, many of the doctors has been died. In Bangladesh, there are 300 or 400 doctors have been died, and in particularly the orthopedic surgeons and our teachers and our juniors, our colleagues, about 13 orthopedic surgeons died. So we remember them and pray to Almighty for the eternal peace. So 100 years celebration of the Abraham Ilizarov, the man behind the institution, man behind the instruction. He's a Polish guy. He was a Polish guy. He was born in Polish actually, in Poland. He came of a Jewish family. And then they came to USSR. Professor Bari has elaborately introduced everything. He came to USSR and living in Kurgan. When he was a doctor, actually many of the doctors in that time, many of the orthopedic surgeons on that time called him quack. He was a quack-like doctor. And he was never mind. He gradually accepted, he teaches the Ilizarov in the living body, in the Homo sapiens, and the animal body also. And in course of time, his instruction and his philosophy and his invention throughout the country, like particularly in the Europe, in the 60s and the up to 80s, and in America, it will be executed, it will be established in 90s. So far the history is concerned. He was recognized as a full-fledged extraordinary academician, scientist, and a magician of Ilizarov from that time. He established the Russian Institute of Orthopedic Center, and after his departure from the world, after his death of the world, actually the center was named today. I think 1 year anniversary of Elizabeth. We have another program in the 15th of June in Nitor, and I talked to Professor Bari that every senior person from Bangladesh and also the great man like you, particularly in India, Professor Harshad, Dr. Samsuluda, in the native land, Sri Lanka, in Maldives, they will be included to our program in the 12 noon, 12 to 2 hours, and from on Nitor. And I request Dr. Tanbit to telecast this from the RISC TV. So you have shown everything in your slides, and you are a great magician, part of the great magician also, like Ilizarov. All forms of bone disease in the body, in the Homo sapiens, it was stated by Ilizarov. Where there is a problem, there is Ilizarov. Particularly, I am very much astonished that the non-union, infective non-union, the treatment is bone corticotomy and bone transport is a very, very interesting subject in the era of medical science in the world. Even in the small bone destruction, bone transport and lengthening, the foot and the hands bone is very interesting, and also deformity correction. So everywhere we see, everywhere there is a problem, if there is a solution, and the solution is bone solution is Ilizarov solution. Today was the plan of the bone tumor. I think this subject is not discussed. I think another one day we have a plan to make a discovery of the bone tumor and how to develop and how to application of the result in the bone tumor and what will be your result. And I think lastly, I tribute my homage and gratitude to Mr. Ilizarov and the day of Ilizarov Day. And remember that man, I have a scope to go to Kurgan Center in 2011 with Professor Bari and a great team from Bangladesh. So in this day, I remembered from core of my heart and core of my soul, and for all on behalf of all orthopedic surgeons in the country, his contribution, his rules and regulation, instruction, and follow his instruction for the mankind, the great discovery and invention of the Ilizarov for the people. And lastly, I salute all of you, and you are the parts of Ilizarov. You are the great soul, fellow of Ilizarov, and you are behind the mankind. You are doing something for the help of Ilizarov. And salute our great teacher, our academician, and the man in the century, Mr. Gabriel Abram Ilizarov. And thank you all in this August gathering. Particularly thanks Professor Bari and RISC TV, Mr. Dr. Tanvir. Thank you everybody, and my best wishes to you, all of you. I have been suffering in Corona, and I was about to die, and post-Corona complication of electrolyte imbalance. So, Harshad, you are our great friend. We have not yet introduced no more, but Almighty has made me alone and to introduce ourselves. So pray to me. I pray to all of you for the people, by the people, and of the people, and for the mankind. Thank you very much for your kind attention and thank you very much.
Thank you. Thank you very much, sir, for sharing your great experience with us. And it's a great day, I think. It's a great day of celebration of 100 years of Ilizarov all around the world. And I think today is the end of our program. And before ending, I'd like to thank our Honorable Professor Mofakhkharul Bari sir, who has spread Ilizarov in Bangladesh, Professor Shevtsov sir, Professor Fadel sir, Professor Harshad sir, Dr. Zang sir, and Dr. Shamsul Huda, and especially Professor Abdul Gani Mollah sir for being with us. Hope we can arrange this sort of program in coming future, and we can share our knowledge and we can share our views to each other to improve the Ilizarov and to spread out the loving touch of Ilizarov all around the world. And finally, I would like to say something, that is, work as if you were to live 100 years and pray as if you were to die tomorrow. Hope you all are well and keeping distance with each other, and be safe during this pandemic time. I am Dr. Mofakhkharul. Want to thank RISC TV and want to thank Renata Pharmaceuticals Limited for sponsoring our program. And I would like to say bye-bye to all of our viewers today. Bye.